Good evening, everyone. It is 6 o'clock, and we certainly have enough people in the room and others online to kick off. So welcome to this evening's meeting of the Health and Wellbeing Board in Ealing. I'm Councillor Josh Blacker, Cabinet Member for Healthy Lives and Chair of the Board. We have others, and for the benefit of those watching, if you could introduce yourselves the first time you speak, that would be lovely, because I'm sure we have a large audience on YouTube tuning in, especially, who would like to know who we are. I don't have any apologies for absence. I think there are a few apologies for lateness. People will come in. I think that the weather is causing issues on the roads and other transport. So people will be joining us as they come in. We don't have any urgent matters. Are there any declarations of interest? No, fantastic. There are no matters to be considered in private, which takes us to the minutes. Is everyone happy that those are accurate and a true account of what we talked about? Yes. Kerry, there was a question on the minutes from Roy. He is online, but just very quickly, it's about whether there's been any progress on the assessment/reviews backlog that we talked about last time. If you want to pick that up for us.
Thank you, Chair. Kerry Stevens, Strategic Director of Adult Social Care and Public Health. Thank you for the question, Roy, as ever, really helpful. The update in terms of the work that's been progressing in this space is that the council's been refocusing resources to tackle backlogs in services. This has included some targeted work on occupational therapy lists, which has seen a 20% reduction in those waiting, has been completed in the last 2 months. Additional capacity has been brought into the front door, the ARC service, as adult social care, and has seen a significant reduction in referrals from the police, CJSMs. We've also completed an audit of the front door services with our external audit, and we're looking to implement an action plan relating to that. There's an engagement with external partners who are going to come in and do some work with us, or bringing in additional capacity to support with the work on the waiting lists. And we've also agreed additional funding for Ealing Advisory Services to support with information and advice from vulnerable people in the community as a way of supporting the work on the waiting lists and demand on the front door. Thank you, Chair.
Great. I think I should probably repeat what I said last time, which is that myself and Councillor Mason do monitor and hold your feet to the fire on those waiting times monthly, I think, at this point, just to try and make sure that we're getting through them appropriately. So it is certainly something that we keep an eye on as well in terms of performance. Does anyone else have any other questions or updates on the minutes? I think we'll cover BCF later, which was one item we talked about as an urgent item last time, but we'll cover that later. Great. So I will sign those as a record in a minute. Carleen, would you like to give us an update on the work of Healthwatch? We can't hear you in the room. Are we able to solve that issue? If you give us 2 seconds, sorry, Carleen, maybe our speakers at this end are off.
They should be okay then.
Carleen, can you just try again? I think you've muted. You're on mute at the moment, Carleen. So
okay.
Can
you hear me?
Yes,
there
we can
go.
hear you now. Fantastic.
Okay, great. Thank you so much. Thank you, Chair. I'm Carleen Duffy. I'm the area manager for Healthwatch. So I've sent through 3 papers that I'll take as read. They were completed under the previous management, so apologies if there's any questions that I need to take away. So as part of our work, we're regularly creating and publishing reports. The 3 that I've submitted is the Whitefriars Enter and View. This was done 2 visits on the 21st of February and the 22nd of May. This is located in Southall, the Whitefriars Nursing and Residential Home. It's operated by the Care and Consultancy Limited for older people and people over the age of 40 with specialist care available for those with dementia, physical disability and substance misuse. During the visit, we engaged with 11 residents, 14 staff members, the manager and the deputy manager. So staff were observed to be accommodating and welcoming on the visit. Residents commonly described as pleasant, a caring environment, good levels of support and staffing and a quick response. There is a residents champion, a family member that acts as a liaison between families and staff. Great care is given when transferring and moving patients. Examples of what could be improved. Some of the corridors do not have handrails installed, and due to the building's age itself, there is some design and environmental issues. Like the corridors are quite narrow and handrails should be fitted along, and we urge that the home assesses and takes this into account in its future renovations. There was also an issue that staff would not always remember to knock before entering a patient's room. There are legitimate reasons for not doing this every time, but during our visit, the practice did appear inconsistent. I'm not sure if you would prefer I take questions for each report or just go through all three.
I think go through all three and then we can
Okay.
take questions at the end.
No worries. So the Black, Asian and minority ethnic patient experience report in 2022, Healthwatch Ealing launched a new project looking to understand the primary care experience of communities from Black, Asian and minority ethnic communities in Ealing. We spoke directly to patients who typically experience a range of health inequalities, hoping to understand some of the issues they experience, such as language, culturally appropriate care, and access to treatment and care. We positively found that 60% of the respondents are complimentary about GP services as a whole. This is in common and in line with general experience received from all populations, not across both Ealing and Hammersmith and Fulham boroughs. Pakistani and Bangladeshi respondents significantly were the least satisfied with the service overall. Just under half of respondents had secured GP appointments with ease, and 28% had experienced difficulty and had to use family members in getting appointments. Broad majority, 73%, felt that ethnicity or skin color or language do not negatively affect the access or care that they receive. Black African respondents by far were most likely to consider ethnicity a barrier to NHS access. The lack of translation can cause inconvenience for family members and carers and delay access to care. A broad majority, 70%, were satisfied with the quality of care that they receive. Pakistani respondents were notably least satisfied with the quality of care they received. Almost 3/4 were satisfied with the treatment explanation. Bangladeshi and Pakistani and Black respondents were the least satisfied with the treatment explanation. Most of this came under patient choice, patient experience, booking appointments, especially through the phone, and the availability of appointments for patients. The Q4 patient experience report, we received 1,211 patient experience collections through February to April 2023. 837 of these were positive, 248 were neutral, and 98 were negative. Negative themes were around the availability of appointments and the amount of staff at facilities. Positive reviews were around the quality of staff that patients interacted with, the convenience and distance to travel for health services, the attitudes of the staffs when they interacted at the health services, the quality of care that patients received this quarter, the support patients received when they accessed the service. That is the key areas for the patient experience for this quarter.
Thank you very much, Colleen. And as ever, 3 chunky reports, and although you point out that you've inherited them, still I will still give you credit for a large amount of work gone into them. So thank you to you and colleagues. Are there any questions in the room or online? I will do my best to spot tiny hands on a screen to my side. Kerry.
Thank you. It's more of a statement rather than a question. A question just to remind the Health and Wellbeing Board that the interim review programme that's been undertaken by part of Health Watch is part of our overall programme to support and improve the quality of services within the care home sector in the borough. So it's much appreciated, and we're working with Health Watch to plan next stage in terms of future interim review programmes.
Great. I know we've taken one before, and it was particularly helpful as well, I think, in kind of helping them then get a good in focusing the mind. So they're really helpful programs. Neha.
Thank you. Neha Unadkat, Borough Director for Ealing as part of the ICB. So I just had a question about the report around the Pakistani and Bangladeshi respondents in particular. And I was really curious as to understand whether they had any indications of why or what they would recommend would change their experience, or whether they were particularly from specific practices, or if you have any more detailed data that could help us then, think about the next steps on that.
Yeah. So the recommendations that we gave in the report were largely around translation services. In general, how people received their treatment and the treatment and care was received positively. One of the recommendations that we have subsequently made since then, since I've come onto post and read through more of this, would be that we often translate for people in medical language. And so until we simplify medical language, it doesn't really feel true to then translate it, because they don't understand the medical language. And so translating that doesn't make sense. We have to first simplify the medical language and then translate that. But in terms of, I think there's just a work to be done around translation services, maybe increasing the amount of translators we have, and that is limiting in what's available. And also I just think there's an issue around some people would prefer that their family are the translator. They just feel more comfortable and more safe with that.
Thanks. Councillor Anand.
Thank you. Sorry, apologies, Chair. I just also wanted to pick up on the page 98.3.8, how I speak has had a negative impact on the quality of care received from my GP surgery by ethnicity. And I think there's some comments where some respondents say that language issues may contribute to delays, booking problems, etc. There is a concern, although your breakdown is more 18% of the Black respondents to compare to the Asian Indians or Pakistanis or Bangladeshis, but it is still a concern that if language is the barrier and it's causing these concerns and delays, what more could we do as a watch group to support the communities so that those barriers could be broken down?
Connie, did you want to respond?
I mean, I think there is, I do believe in collaboration in how can we better translate and communicate with communities that what training are we offering in primary care on how people like to be addressed or how they want to be spoken to. I don't personally know what's been what cultural training we're providing to staff at primary care locations, but I do think that cultural appropriate care is an important aspect of care and how we engage with patients.
Yeah, and I think when Simon gave us an update on the London Northwest strategy, talking about equity of care or equitable care, I think this is a really important report to then use as a baseline to measure progress in things like that. Simon's face has appeared, so I don't know, Simon, if you wanted to, given I've mentioned you wanted to respond on that bit.
So certainly it is a key part of our strategy is to look at the population accessing our services, and if there's any difference in terms of things like waiting lists. Have we got more from particular backgrounds than others on waiting lists? Are we getting more complaints from people from different ethnic backgrounds? So it is one of the work streams that we've set up as part of implementing our strategy to analyse our patient population. We've just gone live with our Cerner new Cerner electronic patient record system. And so that will also help us in terms of being able to analyse our population database and the impact or the challenges patients may or may not have accessing our services, and whether we need to do things differently. And we are linked in with the borough's sort of population health management work stream as well. So we are linking with them with Ealing Council and the networks that you've got in place, so that if there are particular issues we're picking up, then we will hope to use some of those networks to try and make an impact in terms of doing things differently as well.
Thanks, Simon. And Vijay.
Yeah, good evening, everyone. I'm Vijay Taylor. I'm the Borough Medical Director for Ealing. Just a couple of questions I have. The first one is in terms of what decision parameters do you use to decide which nursing and residential homes you're going to visit? And does it triangulate with the provider concerns? Is there any triangulation with Healthwatch on that one? And that's my first question. And my second question is in relation to the Asian and ethnic minority communities report. Will that feed into the Race Equality Commission work in some way or shape and form?
Kerry, do you want to pick up on the provider concerns bit, and then Anna on the rec in terms of when the next health meeting would be?
Thank you, Chair, and thank you for the question, Vijay. The discussions that we had that sets out the plan for this year's Enter and Review programme, last year's Enter and Review programme was very much based on areas, providers where there are areas of concern, number of individuals that were in services with those providers, but also with the Whitefriars Enter and Review, that was a high performing provider based on CQC ratings. So that was almost our baseline to check that the Enter and Review programme was providing learning. I think as Councillor Blacker mentioned earlier, we took a huge amount of learning out of the earlier Enter and Reviews and saw significant improvements in the CQC ratings. I'm not saying there's a direct correlation, but there's certainly a benefit in terms of the learning, in terms of the quality of the offer as a result of the Enter and Review process by Healthwatch.
And then Anna, can we or Councillor Anand, can we feed this into the Citizens Tribunal Health Panel? Even it's not our meeting to control, but is it something we can potentially suggest to the tribunal?
Absolutely.
Great. Is there anything else then on those three reports? No, Carleen, thank you very much again for the work and future work. I'm sure we look forward to getting more of those interim views because, as I said, they're really helpful.
Thank you.
Particularly to us.
I'm just going to note to the board that we have no other issues or matters to arise for the Better Care Fund, and I'm feeling a little bit under the weather today, so I'm going to log off if it can be noted in the minutes that I'm leaving now.
No worries. Thanks very much, and I hope you're feeling better soon.
Thank you.
So we come next to the COVID-19 review, lessons learned review, which did come out of the Race Equality Commission as a demand that the council and our partners learn the lessons of the pandemic. And I think one of them, although there are many to learn, is that actually our communities in Ealing are fantastic, and that sometimes what we need to do as a board, as partners, and as a council is to just support them, and sometimes get out of the way and let them get on with the job and the fantastic job they do. But I don't know, Anna, if you want to introduce the report and the recommendations, and then talk about next steps for it.
Will do. Thank you, Chair. So good evening, everyone. I'm Anna Bryden, Director of Public Health at Ealing Council. Chair, because it's quite a dense report, I was actually just going to talk through this verbally, if that's okay, but obviously can go through details if anyone's got questions. So Councillor Backer's absolutely correct in terms of where this came from. I think we were already thinking locally and had done a number of smaller lessons learned reviews through the kind of COVID response. But then obviously the Race Equality Commission had the very, very specific demand for Health and Wellbeing Board to carry out a more formal lessons learnt review. So we've that's been undertaken across the council and our local NHS organisations at the request of the board. And it was really focusing on learning for three areas. One was that really key thing out of the Race Equality Commission in terms of how do we use the learning in terms of reducing inequalities and that ongoing work. Second was about how we work across our local partnerships. And then third was very practical things about preparing for and responding to emergencies, whether that's a health emergency or something else. So we had loads and loads of information, so many people involved in this. So a massive thank you to everyone. I think for some people it was quite emotional and quite cathartic actually to kind of go back a bit later and really kind of think about it really properly. I think there was a real nice, honest reflections about some of the things we were proudest of. We're also in the lessons for how we could do better. So we were proud of how we did it at the time, but stepping back and reviewing it was actually, okay, well, next time we can do it differently. But there was a lot of pride in there, which was really good, and a lot of really, really strong links with our communities coming through. So the document's quite large. We've presented the key lessons and the key recommendations under 9 different themes. And I was really just going to focus on the kind of summary of recommendations, if that's okay, Chair. So coming out of that in those three categories, so starting with reducing inequalities, there was absolutely loads of learning around how we engage with communities across our local council and NHS organisations, and the absolute how vital that was. You know, links with, for example, links with our faith leaders through the Faith Forum, some of the infrastructure set up. We had little WhatsApp task groups in different areas, so many different ways of doing it, and it really helped us, and it was really a two-way conversation. And so I think there were recommendations in there about structures set up during the pandemic actually were really valuable and really worth thinking about how we do that going forward. And there was some really good learning around how we do always need that combination of universal approaches for everybody. That might be communications, it might be services, but also some more targeted work for communities who might be more at need. And I think a very strong learning point in terms of having to transparently consider the pros and cons of those targeted responses. So there might be areas where we feel something's absolutely needed and we do it. There might be areas where we think that would be great, but actually it will cost us a lot of time, resources, might not be clinically appropriate, etc. And really need to think very carefully around how we do that and have that communication with our communities a bit more openly. Languages, we were just talking about that before, came up really, really strongly in lots of services where we kind of lent on a lot of our local staff who had local community languages, but really needing to think about how we design communications with communities, how we translate things, that kind of culturally competent aspect really came across. Second letter of recommendations around local partnerships. Again, the structures for our partnerships have kind of continued in a different way, which is really good. So I think there's a lot of learning there we've already taken forward, and you can see that in how we work together. There's some very specific recommendations about council and NHS trusts in different ways have information about vulnerabilities among families and individuals, and really thinking about how we share that between us, not necessarily in an emergency, just more generally, and work in a more joined up way. And lots around staff well-being within our organisations, within our teams, between us. How do we kind of carry on with that, celebrate that kind of culture where we support our staff really proactively, really feel that's an important part of what we do as employers, and kind of celebrate those successes. And then finally, lots and lots of practical recommendations about emergencies, things like having an inbox address for teams, so that if somebody's off, you have no idea who to send it to. upskilling both teams and potentially community leaders in terms of supporting emergencies and thinking about how we do that. I think Ealing, like everywhere else, came into this early on with a very traditional response to an emergency, rather than seeing how broad it was and how long it would go on for. That's come out nationally as well. And really thinking about differently about which other teams do we need to bring in early on. So community engagement, housing came up really early on, business liaison, not things that you would necessarily do in a normal kind of emergency, but actually were really key to this. So yeah, just wanted to kind of recommend this to the board. Very, very happy to take questions and comments. Just in terms of next steps, I think the proposal is that we did, on behalf of the board, we do an annual review of this next September. See where we're at across all of our organisations with taking this forward, but very much with an expectation and a request that this is embedded. This goes into lots of different things. So for example, we've got our health and wellbeing strategy action plan. There's a few you could obviously see fit in there, especially around inequalities and partnership work, where the council particularly is reviewing its pandemic preparedness plan, and it was waiting for this to come out to really embed it. So that's the plan, to review it next summer, but with the expectation that it's then embedded across the organisations. That's all, Chair, but happy to take questions.
Great, thank you. I think Councillor Anand wanted to come in.
Chair, not a question, but to congratulate Anna for a fantastic, sort of really valuable piece of targeted work, and the work that we're going to do with a lot of our communities in the borough. And I think in the next steps, Anna, we have captured that the review will be shared with the Independent Citizen Tribunal group, which I would really welcome to have their input and comments, and of course taking VJ's comments as well back to the REC's recommendations and embedding them with the Citizen Tribunal, but also taking the report Anna, to the borough-wide faith forum sort of organisation group that we've set up. Would be really welcoming to understand their views, because they've been huge partners with us during COVID, and we've also learned a lot from our community voluntary sector groups and faith groups. I think it's about sharing this excellent report and then working and developing on that, Chair. Thank you.
Thanks, and I think we all echo the thanks to Anna for pulling this all together, but I think everyone around the room was involved in one way or another, not least in the response, but also in pulling the report together. So thank you all very much. Are there any other comments, VJ?
Yeah, just a bit nearer. Just a comment, really, and mainly around the partnership work, in how you know, health, local authority, voluntary sector, and other organisations that work in the borough really came together in terms of making sure that our priority was to make keep our population safe, and that was really was phenomenal in terms of what we did in such a short space of time, in terms of not only delivering the COVID vaccination programme and everyone being involved in that, but also in terms of how we managed the COVID assessment hubs in Ealing as well, and the mobilisation of the testing as well of COVID, and trying to ensure that those individuals are safely monitored as well. So it was such a tremendous effort that everyone made in Ealing.
Neha.
Thank you. I think the other thing, just to note, so that the report is absolutely fantastic, and it is amazing resource and to keep for Ealing as a memory. And there's so much more depth underneath all of the words that are written here, which it could be very, very long report. And I think you've done a fantastic job at sort of summarising and pulling out the key recommendations. But I think I wanted to just reflect that it's not just on paper that these recommendations are there. I think as a partnership, we are constantly reflecting back on what we did differently during COVID and how can we replicate some of that now in how we work. And it is informing some of our partnership conversations already, and how we solve problems as a collective. And the Better Care Fund is a perfect example of some of that, which we'll talk about later. But it is very live in terms of the learning from it.
Great, thank you. There were two questions, I think, from Roy Willis of Erskag. Roy, are you there to pose your two questions to Anna?
Yes, thank you. I'm Roy Willis, Ealing Social Care Action Group. Yes, the first question is quickly just to welcome the report and say it's very informative and very useful, especially the emphasis on multi-agency partnerships, including the voluntary sector, and also working closely with local communities in what is obviously a very diverse borough. I suppose our question is more to do with how will this report be distributed and communicated locally and nationally, and in particular, will the report be submitted to the National COVID Inquiry so that the lessons learned at local level will be essential to that inquiry in terms of its discussions and recommendations.
Did you want to cover the second one as well? Yeah.
Yeah, okay. The second question is obviously on the same subject. And will the Health and Wellbeing Board add financial resilience and central government funding as being of vital importance to deal with future pandemics or other emergencies? And the suggestion perhaps Ealing should lobby with other London boroughs and the London Mayor on this point, so that the inquiry can be fully informed about the need for local cooperation and partnerships as specified in this report. Thank you.
Thank you, Roy. So in terms of the national inquiry, it's something we've been thinking about locally. We individual councils and I think NHS bodies to a large extent are feeding into the inquiry through our representative bodies. So for example, for me in public health, we've got an association of directors of public health, similar for adults. There's a local government association and then similar up through NHS routes as well. So they are gathering, doing surveys on a regular basis and things like that and pulling together information. All of the things that have been shared so far, all of the kind of recommendations and the lessons that are in our local report, there's nothing there that's different to what's already been shared and experienced by others. It was really to make something very practical for us in Ealing. I am going to share it with our regional colleagues. They know we've been doing this because I think it's one of the more detailed ones in London. So they will have a copy of it, but it would only ever be going up through those representative routes. And in terms of the second question, Roy, absolutely see the kind of financial resilience being really fundamental to this and how services are funded on a day-to-day basis. And obviously we had the additional pressures and the additional funding coming through the COVID pandemic. We didn't have any specific reference to financial sustainability in the report. There were some reflections at the fact that we were in an emergency situation and there was some national funding available helped, but there wasn't anything there in terms of specific recommendations for lobbying other boroughs or the mayor. Thank you.
Thanks. I mean, I think local government funding and resilience of local authorities is something that I think we've been talking about for many years, and only in the last couple of weeks we've seen Birmingham issue their Section 114 notice. I think we know that we cannot provide what we need to provide to our communities unless we are sustainably funded, and certainly adult social care is under huge amounts of pressure, and I think we've just about got over the COVID impact of that cost pressure, but we're now facing the inflationary pressure from the events of a year ago, shall we say, to keep it as politics light as possible at this board. So thank you, Anna. And if there are no other questions, no, again, thank you, Anna, to you and to Helen and others who've put this together. And we look forward to hearing progress against some of the recommendations next September. We move on to the update, and this is you again, Anna, on Public Health Inequalities Fund.
Yeah, thank you, Chair. This is just a brief update. So we shared the paper last summer. The Council Cabinet agreed for £400,000 to be set aside as a non-recurrent fund I think there's lots and lots of discussions and ambition locally in terms of being innovative, trying things out in Ealing, being at the forefront, and especially in terms of reducing inequalities and working together across our local partners. So Cabinet agreed to set this aside as a bit of a pilot to see how it would go and to really fund some innovative ideas across our local partners. So this was really just to come back here with an update for the board. We agreed to fund 4 bids at around £200,000 total. We've put the details in there. I think you can see really good alignment with things like the health and wellbeing strategy, and actually a lot of the lessons coming out of the COVID report as well, especially in terms of things like our BCS colleagues setting up a network of much smaller community groups that work with different ethnic communities in Ealing. So there's a network and some training and strengthening of those communities. And the other example is around co-creating with our community and voluntary partners in terms of a kind of culturally competent resources around reducing stigma around mental health and suicide prevention. So some really, really great ideas and things that we're really keen, and things that will either be a pilot or will get something going, which can then be embedded into work as usual. And we've just gone out now for a second round of funding with the bids closing tomorrow for the other half of the £400,000. So just looking forward to reading those, and we'll bring back updates. And I think the proposal is next year, when we've kind of got a year's worth of activity under here, we'll come back here and just update on where that's at and what that learning is in our evaluation. Thank you.
Great, thank you. Councillor Nagpal.
Thanks, Chair. Just want to say that I think the bids look really good, really innovative, and as Cabinet member for a Fairer Start, the fact that we're engaging young people and getting involved in art workshops is really exciting, and great for helping with mental health. And the oral health, the buses, that sounds very innovative and very exciting. And my son's nursery often tell me that this is an area of decline, children's oral health, and I think certainly in communities where there's deprivation, we see that a lot more. So I think taking the buses to the schools will be really good.
Councillor Anand.
Thank you, Chair. When we see grant funding, I get really excited, and I think that's lots of community groups are going to benefit from this, and they're really going to be able to support the most vulnerable. And I really welcome it, and it's great that we've got the funding. But during COVID, we actually saw a lot of hard to reach groups come to the surface, who were really supporting the vulnerable community, but always find it difficult to access our grants and find it difficult to fill out the application forms. Sometimes are a bit difficult for them. So they shy away, thinking that not going to qualify for the grant. But I saw quite a few groups online who did such a fab job, but still think that accessing some of these grants, whether it's through our partners with the EHVCS or with Southall Community Alliance, do you think we could really work with our partners to maybe there's support for these sort of hard to reach groups to come forward and apply for funding of such kind, which will be really welcoming to see different groups coming forward who do different kind of work in the community?
Yeah, thanks, Councillor Anand. I think that's something that came up really strongly through the health and wellbeing strategy, through lots of feedback. So there's definitely actions under there. We did have some, when we had our national funding for our Community Champions programme, part of that was working with a lot of the small groups. So there was some additional resource through that as well. And I think the example with the CVS group network being set up with some of our smaller ones is absolutely to do that work. So I was so excited to see that one, because I thought it just fit so many boxes. But yeah, absolutely. This is through council teams with a very, very strong emphasis on partnerships. And when we were a panel, if you saw a bid coming through from a council team who hadn't talked to anybody, it didn't sit well, whereas there were lots and lots that had engaged with lots of different voluntary groups. So yeah, absolutely something on our radar and something for us to pick up through that wider strategic work. Thank you.
Great, and then Councillor Mahfouz, and then we've got VJ as well.
Thank you, Chair, and thank you, Anna. In terms of the, so it's great to see those proposals come forward in that first tranche, and obviously we've got a second tranche of funding coming through. You were saying the deadline is tomorrow, so I think just echoing a little bit of what Councillor Anand was saying there, just would we be expecting some bids to be led by VCS organisations? I can see that there's really great input from VCS organisations in all of those proposals, which is fantastic to see, and obviously engaging with them. I'm just wondering whether we're expecting any of them to be leading on any of the proposals that we might see going forward. And then the second question was, I can see in terms of monitoring and reporting back, we're talking about a report back in September next year, which will obviously allow for both tranche 1 and tranche 2 to report. One of the challenges with funding is obviously if it's for a finite period, is obviously how do we then decide whether those projects continue or they just stop at the end of their 12-month period. So at what point will we be deciding whether the projects that have already been underway, whether we'd be looking to renew them at any point, or whether we'd be just going out for a completely new tranche of bids?
Thanks, Councillor Mahfouz. So in terms of VCS groups, yes, I would really hope to see that. You can see with the bids that we approved that we did have some that were very, very strongly partnership. For example, the first one was very much kind of from EHCVS in partnership with our engagement team. So I would expect to see that and would hope to. In terms of sustainability, this was an absolutely key aspect of our bidding round, and it's something we really took seriously in the panel. Non-recurrent money is always tricky, that it runs out and you don't want something to fall off a cliff. So it was a really, really strong part of our panel process in terms of how is this going to leave us with something? Is it a pilot of something that you can then test out with a little bit of resource, but then embed in practice as usual? Is it setting up a network or an infrastructure or something that will then run itself? Or is it developing capacity, say in VCS groups, that will then be taken forward? So that's a really strong part of it. It's a challenge with non-recurrent funding, but I think the ones that we have approved had really good exit plans for that and really good legacies. Thank you.
Thanks. Just picking up what Councillor Nagpal said around the children's oral health. This has been a particular issue for Ealing, particularly around dental caries and dental decay in children. And in fact, in Ealing, we've had one of the highest acute hospital admissions for hospital dental caries in London. So this particular bit around, the outreach work in primary schools, we have done it before. We're going to do it again, and it has been a real success to raise that awareness and do that initial early screening for those children in primary school, and then raising that awareness to the parents to ensure that every child does have an annual dental checkup, which is absolutely important. And in fact, Neha and I met up with the local dental committee today, and we are going to try and link them with public health as well, so that we could start building up that relationship in Ealing.
Thanks, Vijay. And I absolutely agree. And I think this is one very, very small part that's complementing other work that's happening. We did do a few schools on this last year with a different pot of money, and a lot of our team went out and you could really see the conversations people were having. A lot of people, especially without English as a second language or recent migrants, just don't understand the system, don't know what's available. And it wasn't just dental, it was also health visiting, school readiness, healthy weight, loads of different things. So they felt really buzzing, and I think parents were really grateful just to have those human conversations. And again, part of that is it was for kind of 3 years, reception year 1, year 2, to really get parents to understand the local system, understand what's out there, engage with the professionals and sign up for a local dentist. So it wasn't just given a leaflet and leave them to it. It was really following up, and then a team followed up with phone calls a week later to ensure that. So it's something that would be great to run recurrently, maybe not every year, not every school, but it is something in our minds that is an absolute need in Ealing. Thank you.
Great, thank you. I think that's everyone. So thank you, Anna. We look forward to hearing the results of those projects and the second round as well. Which takes us on to the JSNA annual report, which is a very brief update on the work of the JSNA steering group and what's been published last year and what's to be published this year. So I don't think we need to spend too much time on it, but if everyone's happy to note it and the work that we produced in the next year, there are nods, so we shall take that as noted. Wonderful, which means we can move on to the West London NHS Trust strategy. And Chris.
Thank you, Councillor Blacker. I'm not going to do much of the talking for this because I brought along my colleague who did most of the work developing West London Trust strategy. I was going to ask if you would be willing to allow me to share my screen on Zoom, because we've summarized what is, I can do that through Zoom. We've summarized a few of the key points in what is quite a long document to support the presentation today. I guess the summary from West London Trust, where I'm the Chief Operating Officer, is that we're all obliged as NHS organisations to have an organisational strategy. And of course, we benefited from hearing about London North West Healthcare's version of this a few meetings ago. What I hope you will find is that as a provider of services here, particularly in Ealing, where we have integrated mental health and community services, and we're playing a key role in the borough-based partnership, is that many of the themes in this strategy, I hope, will resonate with the health and wellbeing strategy that we've talked here, with North West London's health and care strategy for the integrated care system, including the mental health strategy that's being developed through it. So I guess there's a danger of repetition, but we really welcomed the opportunity to share with you some of the work that George has done. George is our Deputy Director of Business and Strategy, and I'll hand over to him.
Thanks, Chris. While Chris shares the slides, thank you for having us. I think we're going to start by, we hopefully go through this quite quickly. I'm going to start by just talking in terms of just briefly about ourselves, in terms of the trust, who we are as a trust and the areas and population we serve. And then we're going to talk about the strategy development itself, how the process we went through in developing our strategy. And then we'll go on to talk about the priorities that we have agreed and identified as our strategy. And then the final bit is just talk about the next steps and the implementation of the strategy. So in terms of the trust itself, I'm hoping that people are familiar with this already and already know this, but we are one of the most diverse trust in the country in terms of integrated care provision. We are the only trust that is in North West London that is based at an HQ headquartered in Ealing, and we are diverse in terms of our workforce, but also in terms of the population we serve, primarily in the boroughs of Ealing, Hounslow, and Hammersmith and Fulham. Although we do have presence in all the other boroughs, in West London through collaboration and partnerships with other providers. And also presence in we also run the High Secure Broadmoor Hospital, which is in Berkshire. Next slide, please. The next slide just goes a bit more about in terms of the diversity I was talking about in terms of our staff, that actually we do serve quite diverse communities in terms of our population, but also that reflects in the diversity of our staff. If you can see from the graphics there that we are quite a diverse organization, and that has grown significantly over the past few years. The next slide. Next one is just talking about some of the partners. I think we are, as Chris has alluded to, we work very well with a number of partners across the Northwest London ICS, and these are a list of some of the partners that we work with, not the full list, but it's just some of the key partners that we work with across a number of different areas across Northwest London. Next slide. In terms of the strategy itself, I think when we started in terms of starting to think about this was a work that we have carried out over a couple of years in terms of coming up with the strategy. So we had our own previous strategy, last strategy that ran out from 2017 into 2022. And I think where we started was to look at actually in terms of where progress we've made against our previous strategy, in terms of seeing where the gaps are, what we still needed to do around our previous strategy. So I think this is just to capture some of the things that has happened since we from our last strategy in terms of the move from a mental health trust, from West London Mental Health Trust to an integrated care organization. This was so we are now an integrated care organization rather than just a mental health organization. We have taken over the provision of community services, physical health services in Ealing. And led to the establishment of the integrated care service line, so that includes district nursing, MSK services, podiatry, and a lot of other services in Ealing. We've also completed the new Broadmoor Hospital, which is a fully built hospital in on the site as the old Broadmoor Hospital. And more importantly, from a patient perspective, we've moved from a rating of, I think when we did that, requires improvement, to a CQC rating of good overall, with outstanding areas for our West London forensic services as well. And this rest is just to capture some of the changes that have happened since we did the last strategy, COVID, obviously Brexit, the Health and Social Care Bill, which has led to the formal establishment of the ICS and the Ukraine, and also the issue around social justice and inequality around the George Floyd, which I think is actually quite reflective in some of the work that you've done around the Race and Equality Commission as well. Okay. So in terms of some of the further work, again, is around looking at, in terms of what we needed to reflect back in our strategy, was to look at some of the regulatory requirements and must-dos that we have as a trust, looking at the national policy and direction of travel. As I said, some other strategies locally to look at the work that we're doing, our health and well-being strategies across the boroughs, to look at for Ealing specifically, as I said, we've mentioned the Race and Equality Commission, there's some work around the 7 towns of Ealing, and to bring those back into the service user insights as well, and then also a data-driven approach in terms of, we have got as an organization quite lots of data that we get from our services in terms of who is accessing our services, who is not accessing our services, how are they accessing those services, and also the feedback that they give as a result of accessing those services, plus the outcomes of that they get from the service. So we've got quite lots of rich data that we have that we use to also drive and develop the development of the strategy. In terms of the work itself, we did have quite a lot of work in terms of service user engagement. This is going back in terms of working with our services. So we did quite a number of, we've got carers forums, service user forums that we engaged with in terms of developing the strategy, identifying the priorities. We did some work through going to the ward-based groups, in terms of going to the groups and the different ones, talking to patients and getting their input into this. But we also actually had some volunteers that went around to some of our services with iPads and stuff to try and get people to tell them and what they think and feedback and on that. We also did lots of work with our staff, given the impact of COVID on the staff, that there was quite a lot of pressure, and I think, and we really needed to put the well-being of the staff at the center of what we were doing around this. So we did a lot of work with the staff in terms of focus groups. We had meetings, exec-led meetings, where we had all staff groups where we would be talking about the strategy, with our leadership forum, the listening events, to try and get that progress. Going to the next slide, please. And these are some of the key things that were coming out of the work that we were doing through the consultation, through the service user stuff, and the community insights. I think there's access to services. There's a key one. I think it's people want services that are responsive to their needs. People wanted services that would be, rather than them going to services, actually, can the services come to the communities rather than the services come. Inequalities, this was again another central theme that was running through the pretty much all of the feedback that we get in terms of how are we addressing the inequalities. How are we focusing on making sure that those people that are not accessing our services do access our services and have a voice as well. And so if I were to summarize, I think the two key themes that were coming from the engagement was inequalities, access to services, and community, that they need services best in the community. So it's services coming to the communities rather than people going to services. Okay. And so out of all that work, we come up with these priorities as our main priorities. So this is just list in terms of the headlines, in terms of the 5 priorities that were around collaboration and system leadership. This is about working with our system partners to deliver the services that our population want. population health, inequalities, and co-production. I think we have gone past the era where people will just be passive recipient of care. I think it became very loud and clear that people wanted to be involved in the development of services that they feel they are empowered, and that's sort of equal partnership between sort of the professionals providing the service, but also the people accessing the services. Putting people first, I think we have spoken really about the work that our staff had done in terms of the COVID response to the COVID. I think people I think it's across the health and social care, people went over and above to try and make sure that we continue to provide services. And I think it was important that we reflected the needs and well-being of our staff in this as well. And then the fourth one was around innovation in service development and delivery. The world has shifted, the world is moving. How services had been traditionally set up and configured isn't necessarily working. And it's about how do we, as a trust and as an organization, respond to that and make sure that we provide services that will meet the needs, this evolving and changing needs. And then finally, the last one is just about aiming to be an outstanding provider as a trust, that we will be working to be an outstanding provider. And that means being a good partner, being a good leader, providing the best outcome for the patient. The next few slides just go into the bit more detail around each of those priorities in terms of what this means for the population and how we will deliver it and how are we measuring success for each of those priorities that we've mentioned. And then we look at how we monitor performances against and progress against this, because I think this is another key thing coming on from the engagement with the service provider, with service users around actually, what does this mean for me? How am I going to know that actually you are doing what you say you are going to do? And so this is about just really measuring performance against the outcomes as reported by the patients and service users and carers. Inequalities in terms of access, I think mentioned earlier around access to actually waiting lists, for example, who is on our waiting list? Is that, what you would expect based on our patient population? Are we getting more people waiting or not accessing services than others? Our financial performance, CQC rating, and all of those things is what we will be using to measure progress against those. And I think it's just the final step is just to talk about in terms of developing an implementation plan. So I think our next step is now we are developing, having agreed the priorities and working through, is to develop an implementation plan in terms of actually of this as a 5-year strategy. What are we going to deliver in year 1, year 2, year 3, year 4, and year 5? And how we prioritize some of that work. And part of this is actually mapping up in terms of the work. There's a lot of work that's already going on in the trust in terms of meeting our delivery plan. So this is not necessarily about all new things. This is about actually accepting what's currently working, what are the gaps between what we're currently providing and where we are to where we need to be for each of those areas. And this is just a more graphical representation of that.
Thank you, George, for running us through what is quite a complicated document, but I guess really welcome the opportunity to present it here at the Health and Wellbeing Board, because Ealing is kind of our home as an organisation, and really an opportunity to hear any thoughts or observations or input that you'd like into the work that George is still doing with his team around the implementation framework outcomes, and also any thoughts you might have about how you would like to hear feedback on how we think we're progressing. Thank you.
Right. Chris, George, thank you very much. A couple of hands up already. Before I take those, I will use my prerogative just to pose a challenge to you, and you might want to ruminate on it and come back to it towards the end. But to what extent is this a West London Trust specific strategy? I imagine all trusts around the country would want to innovate and aim for outstanding. And a lot of the language, there are fewer mentions of Ealing on the slide than I would have liked. So in what ways is it responding to the particular needs of the communities in Ealing and across the footprint? So just a bit of a pushback and a challenge, because we see a lot of these strategies come through, and we've seen the ICS one recently, and again, all good things that are applicable to all places. So to what extent is it a West London and particularly Ealing strategy? I don't know if you want to tackle that one now or ruminate.
I'm happy to come in on that, and I think I really welcome that challenge, and I'm sure George does as well. I think the devil for us is in the detail around the implementation, because as you say, a lot of the themes, and in my preamble, I guess I was saying the same thing. They're very similar themes to a lot of NHS organisations, very similar to some of the feedback that we received from staff and patients to the strategy that Simon's team presented a few weeks ago, and similar to what will be said in the North West London strategy. I think what's going to be crucial for us in terms of how we make it relevant locally is in some of the work around how are we going to demonstrate that we've done it. So, you know, in terms of the population that we support in the Borough of Ealing, we know that we have inequity in some of the access to our services, in some of the outcomes from our services. Even this morning at our Trust Quality Committee, we were looking at some of our practices, looking at using restrictive practices in mental health, which is something that we are committed to making sure are only used in the circumstances in which they're absolutely required. But breaking that down to the population that we are serving is going to be absolutely crucial. So I think the challenge is really welcome, and the work that I think George is doing is to define the so what here for all of those domains. Yeah. Did you want to add?
Yeah, I mean, I think Chris, you've covered, I think, some of what I want to say, but I think it's part of it. I think it's because we're working as part of a Northwest London integrated care system. So I think in terms of we need some alignment in terms of our strategy with our partner strategies. So there's a bit of that. But I think, as Chris says, I think there's a lot of work that we are doing at the moment. I mentioned the data piece, for example. So when we're looking at, for example, so we look at the 7 towns, and if you look at the data, there's different demographics, different presentation, different needs. What we're trying to do is a bit of work in terms of actually matching that with what we have in terms of people accessing our services. Actually, are we getting a similar picture? Is that different? Actually, if it's different, or is it different? And how do we? So we are doing that work to try and then translate it into something that can then be measurable for the local people.
Thank you. Councillor Anand.
Thank you, Chair. I believe this is a 5-year strategy. And again, like yourself, I would really need to understand what is there in there for Ealing, the improvements, especially around inequalities. And the earlier report that we agreed was the COVID-19 review by Anna, and the work that they've done behind the scenes to make sure that we've captured on the inequalities during COVID and how we're going to be working forward to reduce that gap. I'd like to see, Chair, maybe a monitoring of the update of the report on measuring the outcomes, how that has been developing, because 5 years is a huge time of the strategy, and how would that be really meaningful for Ealing in the outcomes, especially on the BAME community who have suffered over COVID. Maybe some lessons could be learned from our report or shared report, and some of the sort of recommendation, the next steps could be sort of part of your strategy as well.
Yeah. I think we can agree to that.
Fully agree. I think it's some of the work that you're already doing around understanding some of this. So I completely agree, and I'll take that on board and reflect that.
Thanks.
And
Anna.
Sorry, Chair, would we get a monitoring report on the outcomes every year or 6 months?
I think at the request of the committee, we're happy to bring update reports at a frequency you think is appropriate. I mean, at least annually, I think is appropriate.
Yeah, I think possibly annually to start with, just to give yourself, there is still a lot of work, I think, from what you're saying, to do to understand exactly which inequalities we need are there and present. And so I think let's give you some time to do some work on the implementation, and then come back to monitor on how you are implementing it, perhaps in a year's time. Anna.
Thanks, Chair, and thanks, Chris and George. I think that's really good. I think 2 points. I think one, having come from a kind of ex-NHS background and seeing many beige NHS strategies, this actually feels like it's going really in the right direction, and really welcome that alignment with some of our local health and wellbeing strategies, essentially in the inequality side. I think the second side then on the inequalities was thinking ahead to the work plan. One of the kind of sets of actions in our strategy action plan was around how does the board have more of a focus in terms of equality, diversity, inclusion work, what's happening, how are we seeing it, what's our oversight? And actually we've now got a real good set of strategies across the organisations that we can focus. I know in yours that was coming out when Simon was presenting a few months ago, some of the really specific actions around inequalities and thinking about kind of culturally competent services, etc., would be really good to kind of bring as case studies. And so that's something for us to work up over the kind of next few months, is how do we do that as a board? How do we do it in our forward plan? Do we, you know, is it seminars, is it public meetings, a bit of both? But I think we've now got frameworks and structures and recommendations to do that from. So it feels really positive. Thank you.
Thanks. Take Vijay.
Thanks. I think it's important to note that, particularly in relation to West London, you know, it has a lot of adaptability and diversity in terms of flexibility, how it's being provided, both mental and physical health provision in Ealing and wider, which is quite unique for a provider. So I think that's important to note that. Like Josh, what I'm not seeing in the strategy is some key areas around the strategy for West London, particularly in relation to looking at future mental health bed provision, and also step down provision, community provision of mental health services. Their vision for the next 5 years is not coming through in this booklet. Then it may be in more detail in your other iterations of publications, but particularly in this booklet, that is not coming through for me.
I'm happy to respond to that, and I think you're right in terms of the emphasis on this, and it also is that triangulation of strategies within strategies within strategies, and I know that Councillor Blacker and the trusts are involved in conversations about developing a wider Northwest London strategy that gives some consistency across Northwest London. I think buried within some of the deliverables of this, and we skipped through several slides just because there's a lot of detail below them that Georgia's team are working on. In the outstanding section, for instance, the aiming to be outstanding, it links to our aspiration around how we look at the capital assets that we own as an organisation to really emphasise that we're delivering care in premises that are absolutely fit for purpose. And we've done brilliant work in the last basically the last 15 years, being able to rebuild Broadmoor Hospital out in Berkshire. We would really love to get into a place where we're talking about how do we make sure that we've got state-of-the-art facilities in Ealing for some of the beds that we provide, and so that is buried within the strategies within here. And I think that there's the delivering care in community spaces came across very strongly in the feedback that patients, carers and staff were providing, and I think it's one of the things that we do well as an organisation is deliver care. I mean, I think we've got 50 or 60 sites which we have leases for or own, in addition to our staff working in schools and leisure centres, in council premises, etc. So I think we're really keen to make sure that we're doing best, both in terms of the partnership work that we do, and that includes co-location and working in innovative spaces and innovative ways, but also making sure that accessibility that came across allows us to deliver care in an out of hospital space. But very happy to shine a light on some of that when we bring back updates into some of the Ealing specific deliverables.
Yeah, I think that would be really helpful. Thank you. Kerry.
Thank you, Chair, and thank you for the presentation. I'm really interested in terms of structurally how we get the updates in terms of performance, and I think that's part of the discussions we've been having with regards to the function and the development of the Health and Wellbeing Board going forward, but also the work that Councillor Weston is doing within the HASP and understanding where those reporting streams go. So I think it's a really helpful discussion to have, but to understand how we bring that back into this or back into the political space, but also how we do it through the quality and performance board that we've had today that exists within the BBP. So there's a number of steps there, but I think it's important that we follow them.
Thanks. Simon, you're on camera. Did you want to come in?
No, I wasn't particularly going to come in. I suppose, Chris, it would be helpful to understand the distinction between your strategy around your community services and your mental health services. I suppose I didn't get a flavour from that from the presentation. I suppose in terms of the emphasis, clearly what we're looking for as one of your key partners is in improving the timely discharge of mental health patients out of A&E. That's an increasing challenge for us, and also some of the challenges with the change around the police approach. I think that's quite important for us going forward. And also from the community services, West London's role in supporting the timely move of patients from the hospital as part of the discharge, and having that acute capacity, that community capacity to take from the acute, and obviously as part of the winter planning in terms of the community bedded provision as well. But we could pick those up outside of here. But those would be my comments really. I didn't hear much about that in the strategy.
Thanks. That's helpful, Simon. I think it links back in my head to where Kerry was reflecting on how do we define metrics that will allow us collectively to monitor and in other places scrutinize success. And I can assure you, Simon, definitely that our both mental health and community plans are in place for winter, and we've got we know the allusion to partnership in the strategy is explicitly around helping that system flow piece, and it also links with the work that we will do with Kerry and his team around joint working to make sure that we've got integrated responses to individuals in the community. But I think we would definitely be happy to commit to identifying metrics, working out where we're doing quality improvement discussions and assurance discussions in perhaps the borough-based partnership, sharing some of the strategic discussions here, and also being very open to scrutiny in the other place.
Great, thank you, and apologies, Simon, for putting you on the spot there.
No, it's fine.
My eye was caught by the movement on the screen. So Chris, George, thank you both very much for all the work to go into that. And yes, we will look forward to getting up
communities that we serve in Ealing through that pooled arrangement. As you say, Chair, this was signed off in July. I think on behalf of the board as a whole, the 22-20, I'm going to get my dates muddled up, 22-23 is still waiting for national sign-off, and 23-24 is also still waiting for national sign-off. Is that? Thank you, Neha. 23-24 is waiting for a national sign-off going forward. The board will be aware that there is a review that's being set out by North West London ICB in terms of the BCF allocations for 24-25. That's being linked to an out-of-hospital review that's being commissioned also by North West London ICB. But there's ongoing discussions and debate in this space, but I think the position is that we're in an improving situation in terms of funding from national government in terms of BCF. We're in an improving position in terms of the awareness that outer London boroughs have historically received lower funding than inner London boroughs. through the BCF, and the review will be updated through usual member processes. Thank you.
Great, thank you, Kerry. And you know, just as an update on the comments, the discussion we had last time, we were invited, we were required to attend an escalation meeting with regional colleagues to explain why we were late, and I think views were exchanged. And following that, I think the relationship that we discussed last time that had somewhat broken down between us and the ICS on the BCF has improved somewhat. And I think there is a renewed commitment to improving that relationship and working together as we go through a review of allocations for the next year. So more positive, I think, than the discussion we had last time. Neha.
Thank you. I think it is really worth mentioning, there is a lot of work that's gone into this, obviously. There's a lot of funding that's followed as well, additional funding that's followed. And as a partnership, we were in a better place in order to use that funding and develop schemes that's going to help the whole system work in a better way and support the flow across the system. Everyone's hearing about the pressures across everywhere. And part of that is linked to the work that we've been doing on building our partnership, which has been critical, and being ready and learning right the way through the year about where the issues are, where the blockages are. And then as soon as the funding became available, we were able to then quickly agree as a collective, say this is where we need to focus on. I think it is also worth mentioning that actually the relationships at a local level, we try and be very honest with each other and try and solve problems before they become problems. And so that relationship you're talking about with the ICS isn't so much of a local thing. So I thought it's just worth clarifying that.
No, absolutely. It was with the ICB at the very higher echelons. Certainly locally, we're very confident that our partnership is very strong and produces outcomes for our residents, most importantly. Any comments or questions then on BCF submissions? Simon.
Yeah, just in terms of 352, second bullet point, it talks about the reinstated quarterly monitoring of the plan to monitor progress against the plan, saying that was previously put. Who's that undertaken by and with? What's the process for that?
I'm looking at Kerry and or Neha. Kerry.
So the indicators that are set out in the plan, Simon, are part of the council's wider KPI performance. So as the chair mentioned earlier, there's scrutiny and assurance provided within the council in terms of the performance indicators that sit within the BCF, but also sit within the council's corporate plan.
Okay, I just wasn't sure if that was part of the ICS's expectations, but it's a council driven expectation, is it, in terms of the council monitoring?
So certainly for the indicators relating to council activity, yes.
I just wonder, Kerry, whether it's worth further conversation then in terms of whether we look at the totality of the BCF for the health schemes and health aspects of it as well.
Neha.
Yeah, so there's a lot of requirement in terms of reporting. So for the discharge funding schemes, there's literally 2 weekly reporting at the moment. For the Better Care Fund data, actually National are also asking for 2 weekly, and then certain things are monthly and certain things are then less frequently. But as a partnership, I think it's important to build in how we're going to keep an eye on, because these indicators are actually quite useful as a set of system indicators to understand where the pressures are. So it's part of the partnership thinking that we need to do about how we look at those indicators and understand where the pressures are, and then in a live way try and solve them.
Yeah, in a way, I think that'd be quite helpful because in a way, from an acute health perspective, I suppose we see what we know what we're looking for in terms of the discharges, and we know what the budgets at the start of the year, but we don't necessarily see the volume of the activity and the cost implications of that. And I suppose sharing the challenges faced by the council, by the management of the BCF in totality, I think at one level it would help in understanding some of the pressures, and if there's anything that we can do collectively to influence that spend in a different way or a better way, you know.
Kerry.
It's such a good point, Simon. It's something in my role as a DAS and in previous authorities and what we're trying to do in Ealing. The education piece to understand so that everybody understands the whole system impact. So care home capacity, what that means in terms of hospital discharge pathways is absolutely key. I think, as Neha has said earlier, I think in Ealing we have a really strong relationship and strong background of sharing that information. I think what's going to be really important for us is ensuring wherever we're going with the ICS that they're informed and engaged and understand what happens within local systems and the impact on pathways.
And I wouldn't want to advocate or get in the way or ask for anything more to be done, but if you're doing it anyway, sharing that so we've got that shared understanding and also shared support then when there is challenge from the ICS.
Great. Oh, Vijay.
This question is for both Neha and Karen, and I think you already told me about the answers, but I've forgotten. In terms of the financial outturn for 22-23, the 1.9 million overspend. I just want to understand how was that then accounted for and then absorbed in terms of the system finances?
Kerry.
So that I'd need to go away and bring back the detail on that, VJ, but there are significant financial pressures within the council budgets in 22-23 and the use of one-off monies, but I can provide you and the board a detailed brief of how that was dealt with within that.
Great. Any other comments on BCF? No. So the only final item is Health and Wellbeing Board work programme, and a very quick verbal update on what's coming up for us.
Yeah, thanks, Chair. So after quite a few very, very packed meetings, it's getting a little bit quieter. So there's some work to do to forward plan. So November meetings, 22nd November, we've got our adults mental health JSNA. So quite a big one in terms of developing our local strategies as partners. And then I think Neha possibly bringing the medical examiner review of coroner deaths in the community. January, we've got our planned kind of interim update on our health and wellbeing strategy action plan progress, and then obviously the main update on that next summer, and also our carer strategy. And then we've got a few items penciled in for future boards to be planned in as and when things are available. But yeah, we will beef up the November agenda. So if anybody wants to share any thoughts now, really happy to take them. Thank you.
Great. And if we don't need to beef things up for the for the sake of beefing things up, we are happy to take what's required as and when it is required. Great. Well, we will continue speaking to people offline about other items and updates. So thank you all very much for your attendance and for your input. And George, thank you for coming as a non-member of the board. And we will see you all again on the 22nd of November. Thank you very much.
Thanks, bye.
Thanks all, bye.